next 1 year in terms of achieving SDG 6 and, of course, achieving the Ngor commitments. The country dialogues format or the country dialogue methodology is really to allow for, of course, the key word being dialogue, but also in terms of sharing, exchanging, showcasing. There's also been quite a bit of work that has been done by the different countries, and really brainstorming, getting our ideas together, and being creative and solution-oriented over here today. I think it is good that, yes, we do have a good mix of state actors, non-state actors to support these particular processes and ensure that these processes are inclusive and participatory. Ultimately, as mentioned, yes, the end goal of these particular sessions is to prioritize actions that need to be taken forward after Africa Sun. There's been a call, generally, whether it was in the plenaries yesterday, whether it was in the dialogue sessions that were held, that a lot more bolder action needs to be taken to ensure that we put for all in front of the agenda. So without further ado, I would like maybe just for each table to do a rapid introduction. Please state your name and your position. If we can have the roving mic, please. Oh, sorry, I'm the one who has them.
My name is Zumbi Alamu. I am the Director of the Environmental Health in the Ministry of Health, Eritrea.
My name is Abdu. I'm from Eritrea, Regional Environmental Health Coordinator.
My name is Franco Kobaba. I am from Eritrea and local government from Gashbark.
Hi, I'm David Cheche. I'm the head of UNICEF WASH program in Eritrea.
Good morning, Amir Galam Solomon, WASH specialist in UNICEF Eritrea.
My name is Biar Kwai. I'm WASH officer, UNICEF South Sudan.
Good morning. My name is Pasquina Chidja, WASH advisor, NERAS International, South Sudan.
Good morning. My name is Alier Oka. I'm the Undersecretary, Ministry of Water Resources and Irrigation, South Sudan.
Good morning. I'm Lori Castella, State Minister of Health and Environment, South Sudan.
Good morning. My name is Arno Koerver. I'm Global WASH Advisor for Malteser International, supporting the South Sudan program.
Good morning all. My name is Peter Mahal. I'm the Director General for Rural Water Supply and Sanitation, Republic of South Sudan.
Good morning. My name is Bobby Whitfield. I'm the Chairman CEO for the National WASH Commission of the Republic of Liberia.
My name is Leon Tokba. I work for the Ministry of Health and I lead on CLTS in Liberia.
Morning, I'm Akorut Helen Okot, Inspector of Hygiene and Sanitation, South Sudan.
Good morning, my name is Patricia Labina. I'm a WASH specialist with Rural Water and Sanitation Support Agency in South Sudan.
Good morning, I'm Herbert Kashilila, and I work for the Civil Society Network in Tanzania, Tawasanet.
Good morning, my name is Amur Selemani from Ministry of Health. I'm representing Head of Water and Sanitation from Tanzania.
Good morning, I'm Clara Jones from the Ministry of Health, Tanzania. I'm representing the Head of Department in Sanitation.
Good morning, Engineer Wilhelmina Malima, WCC National Coordinator in Tanzania.
Good morning. My name is Evelyn Yasani from, I'm a WASH specialist with UNICEF Tanzania.
Good morning. My name is Awe Emmanuel. I'm the Director for Water Quality Control and Sanitation, Federal Ministry of Water Resources, Nigeria.
Good morning. I am Dr. Priscilla Achakwa from Water Supply, Sanitation and Collaborative Council, but also Women Environmental Program, Nigeria.
Good morning, everybody. My name is Atta Benson from Community Emergency Response Initiative and also the National Coordinator of the Civil Society Network on Water and Sanitation in Nigeria.
Good morning. My name is Alcine Nyakum from Mozambique, National Directorate of Water Supply and Sanitation.
Good morning. Maria Matsin, Deputy Director of Public Health in the Ministry of Health, Mozambique.
Morning. My name is Rushtina Masing Sumban. I'm from National Director of Water and Sanitation in Mozambique.
Good morning, all. I'm Musa Mohamed Waila, a sanitation officer from African Development Bank Assisted Rural Water Supply and Sanitation Program, Federal Ministry of Water Resources, Nigeria.
Good morning. Shiri Nesbet from the National Coordination Unit, Zimbabwe.
All right. Thank you very much for that round of attention. Oh, I'm sorry.
Good morning. I'm Victor Nyamandi, Director Environment Health Services in Zimbabwe.
Good morning. Adewale Bamiji Sakra is my name. I'm working on the AFDB assisted RUASI in Nigeria.
Good morning. I'm Mokpai Victoria Delike. I'm working with African Development Bank Assisted Rural Water Supply and Sanitation Program, Federal Ministry of Water Resources, Nigeria. I'm the MI officer.
Good morning, all. I'm Elizabeth Ugo, Deputy Director, Wash Tracking and Documentation in the Ministry of Water Resources in Nigeria. Thank you.
All right. Okay. Thank you very much for the round of introduction. So, next step would be really to, as you can see, there are a number of posters that have been put up, and this is really countries showing some of their learnings and some of their experiences. So we're going to invite you and the countries to do a quick round, a review of the various experiences that the countries have shared here with us today. We have about 10 minutes, but we will come back and go back to these posters. But I would like to invite each country representative to stand by the particular poster so as to provide explanations. So do feel free to go around, take a look. We have about 10 minutes, and as mentioned, we will come back and regroup. Yes, it's an interactive one, so we'll have to get up. Thank you. All right. If the country representatives, the country delegation can kindly stand by their posters. Yes. One member from a country must remain at their posters while the others go around.
We have time, so we are now at this point. One person in the room remaining participants. So actually we are now participants move to you don't stay too long in one country because you need to select at some point your best country that you want to learn more from. So make sure you have a little bit of everything.
Please, let's keep it moving. Let's keep going round. Let's keep it moving. We will have the opportunity to come back to the posters. That's what I would do. A quick one, please. Don't stay too long in one country. You need to have a little bit of everything. Then you decide later on which ones do you want to dive into. You don't stay too long in one country. You need to have a little bit of concept. Yes, let's keep it moving because we will then go ahead and select 2 countries.
Invest and staff and government, because one thing you talk is sometimes the data does not help us. Why? Because there is to put the data to flow. And this that kind of sustainability is not what you do in your
All right. If we can please regroup. If we can please regroup, there's no need to take your seats. There's no need to take your seats because you will be going back to these posters. But what we need to do here now is that we need to narrow down a bit on the countries in terms of presentation. So if I can have everybody back here, please. And we will ask that one member from each country remains at their posters. But the others, please regroup. At the back over there, if we can please all regroup.
Team Zimbabwe.
If we can please regroup.
Can we regroup?
Yes.
Maybe one person stays here. Others, can we go back to?
Which country is that? South Sudan. South Sudan. Which country? Which country is that? No, at the back. The next one.
Can we, please? We always take the
Yes. Mozambique, please, if we can please regroup. All right, thank you. Now, we're going to try and be as democratic as possible. As mentioned, we're going to narrow it down to 2 to 3 countries. So we'll still request that country members remain at their posters. So we're going to do this by a show of hand. This is really in terms of, we've had our countries, given them about 10 minutes, you've gone round in terms of marketing their lessons and their experiences from the various, from the continent. So what we're going to do now is really narrow it down so that we can learn more about 2 to 3 countries, something that may have caught your attention and that you would like to know more about. So I'm going to read out the countries, and if Sahar, you can help me just with in terms of the numbers. And we will regroup in that way. About who you would like to know more about. Please do it by a show of hands. Eritrea. Anybody would like to know more about Eritrea? Or the experiences from Eritrea? Okay.
Want to raise your hands?
If not.
Okay.
All right.
Eritrea 1.
1.
Okay.
Liberia. Anyone who'd like to know more about Liberia? Okay. Mozambique. Okay. So we have Mozambique.
No, keep your arms.
Yeah.
Keep your hands up.
Keep your hands up.
1, 2, 3, 4, 5, 6, 7, 8.
Okay. Nigeria. 1. South Sudan. 1, 2. Tanzania. 3. And Zimbabwe. Okay.
1, 2, 3, 4, 5, 6, 7.
All right. Okay. Did anybody not raise their hands? Not to hurt anyone's feelings. Did anybody by any chance did not raise their hands? It's all right. Okay, so Sahar, what do we have in terms of the count? So we'll have everybody regroup now as per these countries.
For Eritrea, we have 1.
Okay.
Liberia, we didn't get any. Mozambique, 8. Nigeria, 1. South Sudan, 5. Tanzania, 3. And Zimbabwe, 7.
Okay. All right. Okay. Excited. So we will ask now the participants to regroup within these various countries. And now this is an opportunity to ask further questions in terms of why did this particular country's experience catch your attention. So you will have about 10 to 15 minutes for this process. So I invite you, please, to join these various countries for your areas of focus. At the stands, yeah.
We are going problem is your because so well. This morning, we got to know everything about it. Zimbabwe is on the left-hand side, Mozambique on the right, and South Sudan is just close to the table. Tanzania is also in the top corner on the right.
Okay.
Somebody presented the lesson to all the rooms. So maybe we can just touch base before we start. They're going to have a copy. I did enough. So this is the printout of the lessons. So this is because rather than just the learning from this one, it's the learning from all the country posters that we kind of went through and picked out the main points so that everybody gets to hear about what's going on in the islands. So you'll invite Peter and then he'll go through that and make sure that this is the extract from all of the lecture. Yeah. So maybe if you introduce it, like that.
And at what point does this end?
It's before it's right at the end after it's before they say what they're going to do.
Before the action plan.
Summary of the lesson. No, we put it after.
Is this after?
Okay. One lesson. Okay.
Where
text me if you need it. I see you on it. Sorry about the... Hello, how are you?
So I think we are on the right foot. We are on the right
Yeah,
foot.
that's what I figured.
That was not interesting on Liberia. I think language. I know. I know. Yeah. Maybe the UNICEF staff are representing. Yeah. Comfort to say I just discovered that.
Yeah, I think we're okay. We ask Peter to come in.
No, Peter comes in at. This is where Peter comes in if we have to go according to summary key learning from other rooms. It comes
After
the action plan.
Oh, really? I thought it was before the action.
That's what she said.
Oh.
So when we showed this,
Yeah. Okay. So after. Okay. All right, that works.
But if we can bring it forward.
I think
so
it'll be a good idea, isn't it?
So they know what is
happening
so
in the
when
other.
they are doing their plans,
Yeah.
they make reference.
And that's what I was thinking, isn't it?
Intro.
Yeah.
Introduce this,
Yeah.
then invite Peter.
Peter, yeah. 5 more minutes? 5 more minutes, and then we will regroup.
Something I have seen here. Was it or was it another? Where there is fecal sludge management. Was not here. Was
What?
no fecal sludge. Fecal sludge management.
It's not here.
Let me see. systems? No, in rural, no. So only in urban or peri-urban.
You could alert your guys, for those who don't have copies of this,
Okay, great. Okay, great. Okay.
Yes, one of the things I can is I know if you
Okay.
they use double pit, which move from one pit to the other when the other pit is full, takes 1 year completely compost, and they then use compost to sell the agricultural field and to enrich the soil. This can be one of the ideas that you it's just
All right. We're kindly requesting for everyone to regroup and take your seats, please. Please let us regroup and take your seats.
No. I'm just saying, you guys are doing fecal sludge. Because there is the sludge. There is, because I was there, you guys were doing sludge management at community level. There was the guys that emptied the pits, put to dry.
Mozambique. If we can please take our seats. Yes, it is.
Because this is more on area, small towns.
Yeah, but there is a fecal.
All right. All right, now we move to the next steps, which is really the critical part of this and what it will be presented in the plenaries, which is really the one key action point from each country. One, lessons that have been learnt that we've experienced here today, and this will be consolidated, collated, and presented as well at the plenary. But before we do so, I'd like to invite Peter Mahal to come and give you an overview of what is going on as well in the other countries. This will help you as a point of reference as you develop as well your key action points. That's number one. Number two, I have here copies of the Ngor monitoring report, the declaration. So please feel free to come and take a copy if you need this to support the development of your action plans. So without further ado, Peter, if you could kindly join us over here.
Thank you, Serene. Good morning, all of us. We all who are here in this hall today, or in this room, we are representing countries, around 28 countries. And these 28 countries, they submitted their results. Some of them, we have just seen them in this room as posters. So an analysis was done out of these 28 countries, and the lesson learned that have been found out are the one I'm reading out, because analysis has already been done by the team. Sereni is aware of it. So key learning points from the country posters, some who are on the wall and some that have not been put. The following summaries based on reviews of the key lessons learned from 28 countries that had submitted copies of their country posters in advance. We have tried as a team to pick out common actions that have been taken by different countries which seem to contribute to achievement of the commitments. We know that the Africa Sun 5 is based on the Ngor Declaration. And some of these commitments, those countries have highlighted the following. For commitment 1, that focuses on the poorest, most marginalized, and unserved, aimed at progressively eliminating inequalities in access and use and implement national and local strategies with an emphasis on equity and sustainability. Without the specific focus and concerted efforts to eliminate inequalities, the Sustainable Development Goals targets will remain out of reach. Countries shared the following key actions as key components on how they are addressing inequalities in sanitation and hygiene. About 6 bullet points. 1, undertaking specific studies to identify and understand who the different vulnerable groups are in any context and the challenges they face. So they have decided to say, who are those poorest? Who are those the marginalized? That is step 1 they have started to do as an activity. Second, using disaggregated data to ensure the inclusion and targeting of the different vulnerable groups in the national development plans and sector documents. So after that, they have to segregate or disaggregate. Using clear understanding of the challenges faced to develop and apply strategies and approaches responding challenges and needs of the most vulnerable. For example, livelihood interventions, community funds, targeted subsidies. These are some of the strategies that those countries are using. Bullet 4, developing technologies as one of the strategies or one of the approaches, and systems at national or local level adapted to specific vulnerable groups and contexts, for example, inclusive designs for institutional or household sanitation, on-site and off-site or off-grid sanitation, option for poor urban household. Bullet 5, embedding inclusion and non-discrimination approaches in all interventions to ensure that the needs vulnerable groups can be effectively addressed through capacity building of stakeholders at all levels. And this is some of the approaches some countries have adopted for commitment number 1. Number 6, Bullet 6, establishing mechanisms for tracking and responding to user satisfaction feedback, especially in urban areas. So if there is no feedback, then we cannot be sure that there is something. So there is a need to have this satisfaction feedback developed in those countries. That is commitment 1. In the commitment 2, which is from the Ngor Declaration, mobilize support and resources at the highest political level for sanitation and hygiene to disproportionately prioritize sanitation and hygiene in national development plans as one of the conditions that was put in Ngor Declaration. Countries shared the following action taken towards mobilizing high-level support for sanitation and hygiene. Ensuring that sector plans are evidence-based by using accurate sub-national and national data. Bullet 2, establishing a national sector plan that provides a framework for structured engagement and contribution of all stakeholders, including the private sector, because the private sector is a key in implementation in all our countries. Bullet 3, establishing intersectoral task teams and leadership groups to promote strong intersectoral collaboration, which we have experienced in some of our countries, to lead when there are cross-cutting sanitation in the country. There are bodies that are formed to coordinate these efforts, rather than crying that we are all, the sanitation is a baby without a father or a mother. So you have to create as a technical team to have that body coordinating the activities and let the sanitation and hygiene move forward. Sharing coverage and program results data with all stakeholders to strengthen coordination and implementation of corrective measures. Commitment number 3, which is establish and track sanitation and hygiene budget lines that consistently increase annually to reach a minimum of 0.5 GDP by 2030. And this is a carry-on commitment that was agreed by the government since eThekwini Declaration in 2008. And it is within the same Durban, the Dakar or Ngor commitment. They mentioned the following activities, or they are doing the same as 3 bullets that are following. Packaging evidence-based data and advocacy in a way that targets the priorities of the budget holders to influence decision-making around budget allocations. And using institutional triggering as a multi-stakeholder approach of generating political will and action, mobilizing commitment and financial resources for sanitation and hygiene by using evidence-based advocacy. So you talk with the data. Developing detailed cost analysis at decentralized level which can be aggregated to provide costed plans to reach local, national, and global targets. This is through micro-planning exercise in those countries. Commitment 5, develop and fund strategies to bridge the sanitation and hygiene human resources capacity gap at all levels, national and subnational. Having human capacity to sanitation and hygiene in place is of critical importance to drive the sector forward and achieve other commitments on political mobilization, funding, and leadership. To several countries have taken action to build and maintain human resource capacity for sanitation. For example, understanding the situation in order to address the gaps by carrying out needs assessment to identify gaps in skills and competencies of existing staff and shortfalls in numbers of staff or location of existing staff. Developing capacity building and recruitment plans based on the detailed capacity needs study or assessment that have been conducted in each of those countries. Carrying out advocacy, for example, roundtables to mobilize dedicated national resources for workforce capacity strengthening and recruitment. Identifying ways to strengthen the job market for sanitation and hygiene, for example, by offering a scholarship as one of the options that can strengthen the sector on sanitation and hygiene. Identifying ways to strengthen the job market for sanitation and hygiene, for example, by offering scholarships and encouraging graduates into the sanitation sector. Exploring opportunities to bridge human resources gap by collaborating with other sectors, that is extension workers in the agriculture or rural development. Number 6, ensure inclusive, safely managed sanitation services and functional hand washing facilities in public institutions and spaces. That is at the national level as well as subnational. The countries shared the following actions taken which have enabled progress in ensuring institutional sanitation and hygiene. 3 bullets to support this commitment based on the countries that have presented their posters. 1, working collaboratively with the sector leads of health, education to develop national strategies and implementing guides for institutional sanitation. There's a learning. Advocacy with sector leads for the allocation of resources for the provision of wash facilities in their institutions. Last but not least, the last bullet is working collaboratively with the sector leads of health and education to ensure the wash indicators align with the national and sustainable development goal, specifically goal 6.2 on sanitation and hygiene, are captured in their monitoring system. And these are the highlights from what the countries has presented in the posters. Thank you.
Thank you very much, Peter. Thank you very much, Peter. So yes, an overview a bit of what the continent has been up to. So this will now open really to the next really critical session, which is the development of the action plan and, of course, teasing out the key action points. First, different set of instructions for the different set of countries. All right. Now, which countries had already developed an action plan in 2018? Which countries made a plan in 2018? And is that plan here with you? So we have Nigeria that did a plan, Mozambique as well that did a plan. Yes. Yeah. Go ahead, sir.
During the sub-regional meetings, during the sub-regional meetings, country offices or countries were encouraged to develop action plans. And some of these traffic lights that were shown yesterday by Kitch came from those action plans. After reviewing the baselines, countries were asked to do 3 months, 6 months, 9 months, 1 year action plans. Those are the action plans we are referring to.
Yeah. Thank you. Thank you. So, again, Mozambique, Nigeria, you had done your action plans in 2018. South Sudan as well? Any other country? No? Okay. Zimbabwe? You have a strategy. Okay, I suppose that could. The action plan. All right. So for countries that already have an action plan, your role here today is to review that particular action plan and draw out one key action that will work, that you will work on in the next 6 months, one key action that you will work on in the next 1 year, and which learning has inspired you here today in terms of a country lesson or a country learning. So let me repeat that. One key action that you will work on in the next 6 months, another key action that you will work on for the next 1 year, and one piece of learning from another country that you will use. For the countries now that do not have the action plan, you're encouraged to make a broad plan or a broader strategy. Details can be added once you go back to your own countries. And you're looking at as well at the same thing. One key action in the next 6 months, one key action in the next 1 year, and one lessons or lessons that you have remembered from today's session. So for the countries that do not have this action plan, it is really critical that you address, of course, the needs that are most urgent within the country, and that these priorities must focus, of course, on that one action within the next 6 months. Now, we will pick up your key actions, those 3 items here today. But the final, I believe, is that it should be submitted to AMCAO by the 8th of March for all countries. By 8th of March, this has to be submitted. All right. Are the instructions clear? Yes, Wilhelmina?
Are the one key action to implement in 6 months is for each commitment or generally one?
Just generally one.
Okay.
Just one per country.
Okay.
One key action that stakeholders commit to within the country.
All right.
Yeah? Okay. So, I repeat, one key action for countries that already have an action plan, one key action out of your action plan that you commit to in the next 6 months, in the next 1 year, and which lesson over here inspired you. For the countries that do not have an action plan, the development of a broader detailed or a broader plan that you can come up with, identifying, what would be your action plans and what are the issues that need to be immediately addressed. So you do have approximately, Sahar, where is Sahar? about 20-25 minutes for this. Please let each group have a chair and a rapporteur. You have the flip charts over here. Feel free to take the flip charts.
Yeah, read, just read. Yeah. We will align them later. So that's already, the process is ongoing. That's something we can deliver. We can deliver that. But you can report some progress if it has not been completed by then. It's possible to report on progress.
But it has
Ongoing, yeah.
So that is within 1 hour.
We just go there. It's just that it's not smart. But it's not smart, yeah? That activity is not smart. So what? So what? Yeah, so what? No, I'm just saying the activity, the way it's framed, is not smart. Because it just, I wanted to ask. And it's not result-based.
You wanted to do it individually?
Lakini pazuri iko. See results. It's not just starting a discussion. Process results. just 1 year. Actors. It will beyond, it will go beyond, yeah, hard courses. We are reviewing it anyway. But a market assessment, it is possible to, sanitation market assessment. Of that. Yeah. It's complete.
I mean, I saw you on social media. I thought maybe you were on the secretary or anything.
So, yeah, I think.
Yeah, like this. You want to write it yourself? Yeah, like that.
Actions now for tracking investment in some, how many, what else that?
Want to send me?
No, put.
right. Because we only have another 10 minutes, 15 minutes, we will need to release the room. We'll please ask everyone to regroup and to have the rapporteur of each country come up here and join me.
Mapping of finances. It will be. So, are we?
Okay. Can we please have a rapporteur from each country? Nigeria? Ready? Who is ready? No one? South Sudan? Are we ready? We can have South Sudan over here. Eritrea? Are we ready? Okay. As mentioned, we really need to close this meeting within the next 15 minutes. You don't need to get into great details, but just to come up really with those 3 action points. Mozambique? All right, thank you, Peter. South Sudan first. Liberia, Tanzania. Zimbabwe is ready. Thank you. South Sudan is ready. If we can please come up. Zimbabwe, ready? Great.
Instead of village, no, no. In terms of certificate, villages, we move now to.
All right. Ladies and gentlemen, we really need to end now. Can I please ask everybody to come up? Tanzania, are we ready? Yes, all right. Can the rapporteur please come up? Zimbabwe? Yep. All right. Can please all the rapporteurs come up? Eritrea? Not ready. Okay. So we will just proceed with those that are ready because we really need to close the meeting. Mozambique? All right, so I'd like to invite Peter, can I please have your attention? Tanzania, please come up. Zimbabwe, please come up. Nigeria, please come up. Okay. Yeah. All right, can we please have your attention? Mozambique, are you ready? Please, let's come up.
Yeah.
Please come up. We don't have 5 minutes, unfortunately. We're not even 2. We really need to start. Okay. Okay. Can we please have your attention? I'd like to invite Amor. Okay. Amor Salaman from Tanzania. So just very brief, please, panelists, just keep it very brief in terms of presenting your action points and your lessons learned.
Thank you so much. For the case of Tanzania, we have one key activity we want to implement within 6 months, which is upgrading our electronic monitoring information system to include equity indicators. We didn't fare well in the past implementation. We didn't capture the indicators. We based on MDGs, so now we want to include the equity indicators. That's what we want to do within 6 months. And we want, within 1 year, to have developed and rolled out the strategy for reaching the last mile and the ODF strategy. We want to move from the ODF villages, which we track now, to tracking the ODF at ward level and district level. Already we have 1 district, which is ODF. And what we have learned, and what we have learned, which we think of taking back home, is the development of a national CLTS forum. We learned that from South Sudan. We liked it.
Okay.
Yeah.
Thank you very much. Thank you very much. This is giving us time. Next, Nigeria.
Thank you. For Nigeria, we are taking the action from the commitment 2. And for the next 6 months, we are believing that the advocacy to the sub-national government to prioritize sanitation and also increase budgets going to sanitation will be very useful in attaining the SDGs. And also, we are going to do that. There's also the engagement within the next 6 months of the First Lady of the country, and other sanitation champions like the governor's wives will be engaged to champion the open defecation campaign, and will also involve the Nollywood actors and musicians, prominent musicians, to be able to carry up this campaign, so that there will be buy-in even at the grassroots level. That we intend to do. Then we are hoping that for the next 1 year, the states already have this roadmap. So for the next 1 year, we see to the implementation of the roadmap that is done. That's where we'll be able to get and achieve the SDG for sanitation. And from the lessons learned from Mozambique, we have, just as we also saw from the visits to India, that getting the support of the highest level of government, the president being involved, is something that will carry the country to meet up the SDGs. Thank you.
Thank you very much. Thank you very much, Nigeria. South Sudan, Peter.
Thank you, Serene. I'm representing my team. Actually, we are a number, so for all of us to convince ourselves, we look into the commitments and the previous activities, and then we made the kind of, putting kind of a right tool to use to agree. So the tool we used to agree was to tick, look into the commitments, the activities, and then each ticks. So at the highest activity that was ticked is what we adopted as one of the commitments we should take out of the 6 months, for 1 year, and even the same thing for the lesson learned, we agreed on the same process. So the first one for the 6 months, we took it from the commitment number 4. That is for the 6 months, which is through the Sanitation and Hygiene Technical Working Group that is already formed and it is there. we call for meeting to be convened and make kind of a memorandum of understanding between the institutions that are actually implementing sanitation and hygiene in the government of the Republic of South Sudan, so that they speak as one language and have a streamlined importance of sanitation and hygiene as a sector by itself. So that is commitment number 4. We took this activity from it. For the 1 year, we took it from the commitment number 8. And then this is the activity we have agreed upon by majority to mobilize public-private partnership to scale up sanitation and hygiene in the country and eliminating open defecation in line with Ngor Declaration and the Global Sustainable Development Goal, specifically Goal 6.2. Now, the third point that we have agreed upon, learning from the room, South-South learning, we found out that in the same region of Eastern Africa, we found that Tanzania have actually done very well by having only 3% remaining for ODF to be declared ODF. And the lesson that we have learned from them is that they have a very clear data baseline, very clear. And we even learn from them now they are including some of the things that were missing, like inequalities to be included. So we can learn from this, that we adapt the same way from them, and we include what they have seen as a challenge for them, so that we start fresh with that. So we put it as one of the action that we have learned from. Thank you.
Thank you. Zimbabwe?
Thank you. I think I'll be very brief. And in fact, for the Zimbabwean delegation, we indeed are from the National Sanitation and Hygiene Task Force, which is chaired by the ministry responsible for sanitation and hygiene, the Ministry of Health. So the commitments that we have made, we have really learned that we need to strengthen a political commitment for sanitation in Zimbabwe. That's what the Indians did. That's what we got from Nigeria, from the emergency sanitation intervention. So we have time framed our intervention into 3 months in the next 12 months. And in the next 3 months, we are going to have targeted briefings with all the ministries that matter. The ministry responsible for local government, ministry responsible for health, responsible for water, ministry responsible for finance, including the office of the president and cabinet. And after that, we will have a high-level workshop for acceleration of sanitation. In other words, we are discussing with the political elite the roadmap, and we would socialize them on the principles on sanitation and hygiene. And the third one that we'll do in the next 3 months is we have to finalize the sanitation plan with clear targets. And in the next 12 months, we are focusing on the enabling environment. I think there are areas where there's still some outstanding work. So we would need to look at the plan for each and every commitment. What is it that needs to be done? When are we going to do that? And the last but not least, in the next 12 months, is we're going to finalize review the action plan and the investment plan. And that's the last one. But the intention is to have the president launch a national campaign to eliminate open defecation either during the Global Hand Washing Day commemorations or the World Toilet Day commemorations. Thank you so much.
Thank you very much. Thank you very much. For the countries that did not come and present, I urge you please to see Sahar, and please make sure that your notes are forwarded to him. We really need to close the session. Thank you very much to all of you for your work and your support. Quick announcement from Tanzania that did well on the leadership front. Please see with the Tanzanian group, their minister tomorrow will be discussing more on issues of leadership and how to how do we catalyze action and leadership within the sector. Thank you very much. Thank you all.